wanted to put out an update to the video I sent out a couple months ago, just with pigtail chest tube insertion. So as you can tell, I'm at Swickley today. This is what our chest tube cart looks like. It exists between trauma A and trauma B. At Beaver, the cart looks ever so slightly different, but similarly equipped. It sits in the back of trauma A. Each of the carts are labeled, and it has the items that you need. And if you remind yourself, everything that you need for chest tube insertion, whether it be pigtail or traumatic, is going to be in the cart, labeled, kind of going down. For initial insertion, you'll have your sterile gloves, you'll have your betadine, the 2-0 silk sutures that you utilize at the end to kind of sew it into place, 4x4 should you need anything else. Second drawer here at Swickley just has our Stay Fix. If you remember, these are just simply new 4x4s that have a slit there at the top middle that allow you to kind of slide it right over the kit or the catheter after your insertion. Third drawer is kind of the money drawer. This has our custom paracentesis kit there. I have one that's open. I'll kind of show you through. There's also suture kits that exist within these. I took one out. I'll kind of show you as we go through. And then it has the individualized things that you're going to need, from the guide wire and tissue dilators for insertion. As you go down, the bottom drawer does have the catheters themselves. Remember, we have two catheters, Breeze and Uracil. They're both the same except for the locking mechanism that's there at the end, as well as our Plurivac, and then we have our drainage connecting tube that I'll talk about here in a little bit. The fourth drawer has everything that you're going to need for traumatic chest tube insertion. So 32 French, 34 French. It's going to have the long curved Kellys for insertion, and we also have sterile gowns as you sort of get ready. So as we move over here, I just have some of the items opened up. This is our custom paracentesis catheter insertion kit right here. It's got a 10 cc syringe, lidocaine, our fill needle, everything that you'll need for insertion. It also has a sterile gown, so as you get the patient ready, you can put it there. It also has a scalpel within it. The one thing that most, if you haven't done this before, you may not be used to, this is our 6 French angiocath. This is what we're going to be doing with the initial insertion. All right, there's a long needle that is here that kind of goes into this. This is actually, when you open the kit, these will be together. We'll do the initial insertion, and then everything is Seldinger technique from that. We have our guide wire. Remember, the guide wire is longer in these kits. They're 90 centimeters, and so when I've inserted these in the past, I'll typically insert the wire and actually kind of bend it in half or hold the end. That way the wire is not flopping in the wind. Next, we have our dilators. We have both 8 and 10 French. With anyone that's larger in size, you're probably going to need to utilize both dilators, dilating initially with an 8 French and then a 10 French. For anyone that's skinnier, you can probably get away with just doing the 10 French. And then as we move on, we just have our pigtail catheters here. Remember, we have two types. This blue one is the Breeze. The other one, the black one, is the Uracil. They're both 10 French. They're both locking. The locking mechanisms are ever so slightly different in them, but otherwise they're pretty much exactly the same. They both do come with an internal trocar. You can actually slide this out to the very end and just traumatically insert that. That does come with some peril, inserting a 10 French cath blindly, but you can do that if the patient's in extremis. Otherwise, you don't need the internal trocar. That can be removed when you do insertion. The kit also has like a little pleural drain. This is just a long plastic tube. We're not doing pleural drains, but that's why it's in there. You don't need this for just for straight pigtail catheter insertion. And then ultimately, the last thing is our chest tube kind of drainage kit connector, which there's a couple different products, but they all look the same. They have this threaded component that's going to hook onto the backside of the catheter, and then a wider component that's going to hook onto your Plurivac. So I'm going to just switch you around here so you can actually see me doing it here for a second. So I'll talk through this as we're kind of going. All right, so this is the patient. So if you can imagine, that's the patient as we're sort of going through. I've already sort of made a slight incision there. And so what I would have done, I would already have anesthetized the patient with the lidocaine that I have in my kit. I would have already, gowned and draped the patient as we kind of go through. The drape, again, is in the paracentesis kit. You'll just kind of put that on over where you're going to go. As you identify your landmarks, remind yourself you cannot really go too high. You can certainly go too low when you insert these. It should be anterior axillary line right outside the pectoral tissue, aiming between like the 4th and 5th rib space. But again, you can't go too high. So if you're concerned about it, you can't quite tell your landmarks, just aim a little bit higher, aiming up towards the anterior axillary line. So 10 cc syringe that's in the paracentesis insertion kit. I have my lidocaine. I've already infiltrated the area. It's already been cleaned. And then I take the same 10 cc syringe with a little bit of lidocaine that's still left over and hook it up to my 6 French angiocath that's in that paracentesis kit. All right. with the lidocaine in there, you can then tell when you're in the pleural space because you're advancing it with negative pressure. As soon as you see some of the air bubbles, you'll know you're in the right spot. So I'm going to go again, I'm going to aim superiorly kind of towards the apex, up towards the SCM or the sternocleidomastoid mastoid muscle, going up, negative pressure. You see some air bubbles, you know you're in the right spot. You can then thread the catheter down or advance it probably 2 to 3 centimeters, and then pull the rest of the mechanism out that has the needle in the 10 cc syringe. So right now, if it's a tension pneumothorax and it's just air that you're taking out, you're in a good spot because you can decompress the air. If you're concerned or interested about it, you can take the 10 cc syringe, put it on here, suck some of the air out. Otherwise, catheter just stays in place for the wire insertion. So next up, it's just like central line, you're going to be putting the wire in. The wire, 90 centimeters long, one end is a little bit flimsy. The initial insertion is a little bit flimsy, so it's not going to puncture through anything. But same thing. It is 90 centimeters, so you don't need to insert nearly the entire thing, but it threads directly through that wire that we have. The end of the wire, the time that I've done this, is actually pretty irritating. It can be. I think I got it up through and hit something in the guy's mediastinum, and he did move a decent amount. So that's the one thing you need to prepare yourself for. Patients may move or be a little bit irritated, but again, it's very flimsy at the very tip of it, so you're not going to hurt anything as you internally put it in. So once you got the catheter, again, it's decently long. You may need to hold the end of this if you can't insert it, you know, it's kind of all the way, because otherwise the catheter is just going to sort of flop into the wind. So wires in place. The 6 French angiocath can be removed. That wire's not going to go anywhere, and then that can be discarded. The next thing that you have to do is you have to do the tissue dilation. So you're going to take your 11 blade scalpel that's in that insertion kit. You're going to dilate the tissue right on top of the wire, just like you would for a central line, and then you're going to be sliding your dilator down. There's actually a decent amount of thickness to these wires, so you can dilate, but if you get too crazy, these wires will bend. Remember, you're really just dilating that tissue track, which, again, depending on the patient, is going to be between 2 and 6 centimeters or so. So you just got to get down, you know, about 1/4 to half the way on your dilator, dilate that tissue track, and then you should be absolutely fine for insertion. So last up, you just have your actual pigtail catheter itself. So remember, they do come with this internal long trocar, okay? We can do kind of general insertion just with that, but otherwise you do not need that internal component. So that big long needle can just be removed. And then your pigtail catheter itself is going to be much more flimsy. So the Breeze catheter and the Uracil have a little plastic component here that just allows you to straighten it so that you can thread it over the wire, right? So as you get the very tip of the catheter out, hardest part is actually finding the hole. So once you get the wire into the catheter itself, you're retracting the wire until you control the tip of the wire, and then the actual catheter can be inserted. Now this little plastic, the plastic sort of thing that allows you to straighten is actually slotted, so it can actually just be pulled right off the catheter. You're not going to insert that into the patient, obviously. So that'll just pull right off after you have this in. So then you're inserting all the way, and it has markers on this. Now the depth is going to depend on the patient, right? It generally takes probably about 15 to 20 centimeters to get in. You want to get this up into the insertion site, so you don't need to bury this to the hub, but it does got to be down a decent amount of way so that you're into the pleural space enough. But once this is put in, you then just extract your wire, and you're basically almost done. So the last component that you need to do is the actual locking mechanism of this. So if you can see here, I'll slide this ever so slightly closer so you can see. This has a small clip right here, and then there is a plastic kind of insertion type on the hub itself. All that needs to happen is this is tied to a suture at the very tip of the catheter itself. So you pull this out about, that's about as far as it goes, so it's about 3 centimeters. This wire the suture can be wrapped around the hub, and then you just clip it right there, and then you can actually break this plastic clip off so that it's not going to go anywhere. And then what they do is they just cut that at the very end. That can be taken out. So now the pigtail is locked. You will then use your 2O silk. The 2O silk is going to sit in a top drawer. It's right here, and this is when you're going to need the suture insertion kit. So get your suture insertion kit, and just like you would suture anything else, you're going to suture it to the skin, tie it down to the wire. or tied down to the pigtail catheter itself so that that's firmly snug. And then last thing is the Stay Fit, the kind of just topical adhesive. It is slit right there at the top. So this just, as you take the adhesive off, you're actually sliding it through, and there's a little plastic clip that the tube itself actually then locks onto. So it provides a little bit of a better way to do it than just the suture. So if you don't have this, you can just do tape. You can do cut 4x4s. You can do Vaseline gauze kind of on that area. Otherwise, there's really no way that's any different. And the last thing, or the second last thing, so the Uracil catheter is ever so slightly different. And if you have questions about this, the insertion is exactly the same. You straighten it exactly the same, but there's actually just simply a locking mechanism at the very tip where you're just, instead of pulling the suture out, there's a little clip here that you just slide back. So you're just sliding it back, it clicks into place, and that's how it locks as you kind of go through. And then and as you've got it sewed in, you've got it all done. To hook it to the Plurivac, we have our drainage connecting tube. Again, it has a small threaded portion that's at one end, and then it has a larger portion at the other end that's going to go into the Plurivac. The threaded portion goes into the pigtail catheter, and then you hook it up to the Plurivac. Typically, these people are going to be on wall suction. That's something we can kind of talk about as we go forward. But any questions about this, please let me know.